Hello, everyone. It's the last day of September, September the 30th, Wednesday. We're still confronting many West Virginians that we're losing. We've lost an additional 13 West Virginians since Monday. Now we're up to 350 deaths in West Virginia. Now, on a good note, and I just had our people pull these up, but in all the surrounding states, West Virginia now, with 13 additional deaths today, has 350 deaths in West Virginia. Now get this, the closest state that is a surrounding state to us has 1,170 deaths, 1,170 deaths, nearly 4 times, or 3.5 times, as many as West Virginia, and that's Kentucky. Then it jumps to Maryland, who has 3,949 deaths, and that's almost, it's 11 plus times what West Virginia is. Then it jumps to Ohio, which has 4,783 deaths, which is 12 times plus West Virginia. And then it jumps to Pennsylvania, who has 8,142 deaths. So from the standpoint of our surrounding states, what we have tried to do and what you are doing in West Virginia is amazing. If you consider just this, we're the oldest state, the sickest state with the most chronic illnesses, absolutely the state of the most vulnerable of all. And you look at your numbers, 350 in West Virginia, 1,170 in Kentucky, 3,949 in Maryland, 4,783 in Ohio, and 8,142 in Pennsylvania. They don't have Virginia on here, but so I can't report on Virginia, but I think the number of deaths in Virginia is somewhere between Kentucky and Maryland. I'm not exactly sure. But the reality of that is just really simple. To these 13 families that I'm going to read you today, none of those numbers really mean anything, do they? So please remember and keep these families in your prayers, your thoughts, absolutely in your memories. Our 338th death is a 70-year-old male from Logan County. Our 339th death, a 70-year-old male from Putnam County. Our 340th death, a 79-year-old female from Wyoming County. Our 341st death, a 73-year-old male from Berkeley County. Our 342nd death is a 81-year-old female from Putnam County. Our 343rd death, an 84-year-old female from Putnam County. Our 344th death, a 73-year-old male from Monroe County. Our 345th death, a 78-year-old female from Taylor County. Our 346th death, a 56-year-old male from Fayette County. 56 years old. Our 347th death, a 68-year-old male from Kanawha County. Our 348th death, a 95-year-old male from Boone County. What an unbelievable life. Our 349th death, an 81-year-old female from Putnam County. And our 350th death, a 68-year-old male from Kanawha County. Again, please remember these people and all their families and all their loved ones. Today we have 146 new cases. That's probably better. We have a daily positivity rating of 3.86. That's maybe okay or a little better. Not as nearly as good as we want it, but it's better. From the standpoint of our cumulative percentage of positive cases, we're at 2.76, and that's at least, I think, beginning to trend the right way. Our active cases are still just slightly under 4,000. They're at 3,991. Our recovered cases are at 11,507. Our hospitalized patients are 169. All this seems to be pretty steady. Today, our effective reproduction number, RT number, is at 0.94. That's the 11th best in the entire country, and that's better. We have no counties in the red. We have Kanawha, Barber, and Boone County in the orange, and we're continuing to aggressively test in those counties, all those counties, and hopefully we'll be able to report to you that at some point in time, very, very soon, that that all of our counties are out of the orange and the red. That would be great stuff. But it would be way more great, if we were able to identify the spreaders that we're missing that are asymptomatic out there that we can't possibly identify if we don't test a whole lot more. From the standpoint of our free testing, you'll see all the places we'll be, across the state, and we encourage you in every way to take advantage of that. All you got to do now is pull it up on the website instead of listening to me read it. From a standpoint of Kanawha County, we're blanketing these counties, that are orange and red, or orange right now, because we don't have any in the red. We've done a lot of free testing, in different places in the county, trying to get an appropriate cross-section of the whole county. We're going to be today, but we'll be all day tomorrow. I guess my notes say that we'll be all day tomorrow at George Washington. Now, we do need to double check that, because I was told we were going to be there from 3 to 7, but is it all day tomorrow? But I'm reading it as all day, so we'll have to make it all day tomorrow. Also this week we're going to have testing events at South Charleston High School and Riverside High School. So far we've tested over 900 people at these events. I know we had a big turnout at maybe it's Elkview Middle or Elementary School, and I know the turnout at GW has been, I think yesterday we were somewhere around 350 tests taken there, and it was just done in 4 hours. That's people really getting it. I mean, and so they said that they were busy nonstop for the whole time, and so we've had a lot of people at least in that area that wanted to be tested that hadn't been tested. That's good. Again, I strongly encourage any and everybody to go get tested, because even if you don't have any symptoms and everything, absolutely, we have the opportunity then of identifying positive cases, and then just being able to isolate them and contact trace them and everything. It will give us the ability to stop this dreaded disease, and that's the only way we're going to find it. That's the only way we're going to do it. And whether people like it or don't like it and everything about how we've modified and changed things, we're doing the right thing, and that's the only way we're going to be able to identify it. And so we really need your help. Go get tested, everybody. We'll, because we went to Boone County, I guess, Boone County went orange yesterday on our daily map. We're offering free testing tomorrow from 10 to 4 in Boone County and at the Boone County Health Department in Danville. And so this is, a recurring event, and it will happen every Thursday. And so go get tested, Boone County. Now, from the standpoint of the flu vaccine, and we had one other county, I think it was Barber County, and I don't have the information on testing in Barber County, but I know we're there, and we're going, and you can rest assured that if we're not there enough right now, we're going to be there a whole lot more. So we're going to have to get more and more testing going in Barber County too. As far as the flu vaccine, please get your flu shots. Everybody's telling us, get our flu shots and get our flu shots. I'm going to do mine, I guess, on Friday here and everything. So everybody will see that there's not much to it. And it does protect, and it does really help us. And especially with this COVID situation, we need everybody to be getting their flu shots. And this is for everybody of the age of 6 months and older. So please take advantage and go get your flu shots. I think it was, I can't recall if it was yesterday or the day before, but there was well in excess of 100 people that got their flu shots at GW too, so that was good. From the standpoint of our school outbreaks, we now have 17 active outbreaks with 40 confirmed cases in the public schools. Now let's just talk just 1 second about this. We've all been told over and over and over, we all know over and over that really and truly, as we go back to school, we're going to have more cases arise, and we're going to have to address those situations. If we didn't go to school, we'd have cases arise from people that went to Walmart or the Dairy Queen or the family picnic or whatever, and they wouldn't be identified to the schools, but we would have more cases arise, would we not? Every day, I am reporting to you 143 cases, 268 cases. They're coming from somewhere. And so from the standpoint of the school outbreaks, we're on it, we're watching it. You've got my absolute, positively guaranteed word that we will absolutely, in every way, try with all in us to first and foremost be safe. That's the whole thing. First and foremost, we have to be safe. For the kids, for the teachers, for all the service personnel, for everyone, we have got to be safe. But in that, we've got to go on. We have got to go on. So as we have outbreaks, and we will, then we run to the fire, and we absolutely contact trace and do all the things that are necessary to do. I did want to tell you real quick, we will be at GW all day tomorrow, and we were in Barber County yesterday. Now, from the standpoint of our long-term care facilities, we have 36 outbreaks in the long-term care facilities. From the standpoint of our churches, I think if I remember correctly, we went down all the way down to 4 outbreaks or whatever in our churches. We now have 10. That's not as good as we were. We have churches in 7 counties. Logan is a new one, and God forbid, we know what could happen in Logan County. It's already happened one time. McDowell is a new one. We've got outbreaks also in Tucker, Harrison, Nicholas, Fayette, and Kanawha counties. Now, we got to use what I said over and over and over. A pew in between, a mask. Absolutely, if you're an elderly person, you hear all these names and all these ages that we read. Absolutely, if you can take and get your, church services online or whatever, and maybe take a few weeks off and everything, right now it probably would be smart money to just do that. Corrections update. We now have 7 active inmates, inmate cases, which 6 of them are at Mount Olive and one is at the North Central Regional Jail. You know, in the corrections, from the staff, we have 16 active staff, and 9 of those are at Mount Olive. From our small businesses, we have now in excess of 8,000 applicants. 22 million has been awarded. If we have a postmark or something that is reasonably, you know, in process and everything, we're going to continue to process your applications. But we need, you know, but today, midnight tonight is the deadline, and if you don't have your application in with a postmark on it or something that's happened with the mail and everything, you know, then we're going to have to wrap this small business program up for right now. From the standpoint of our cities and our counties, we are at $127,164,865 that have been awarded, and that's to 191 cities and counties. Our census, we are at 99.9. We are first in the country with your response, West Virginia. It's an incredible, incredible achievement, and it will pay dividends to this state for many, many, many years to come. And the only other thing that just a second ago, and let me go back to that just real quick, but I was going through and I was, telling you of where the other states stood as far as the death toll in other states. West Virginia was at 350. I said Kentucky was at 1,170. Maryland is at 3,949, but Virginia is slightly less than Maryland. They're at 3,208, and which is almost 10 times as much as West Virginia. And like I said before, Ohio was at 4,783, and Pennsylvania at 8,142. So from that standpoint, West Virginia, you've done an amazing job, and you just got to keep at it. You just got to keep at it because this thing is still with us. We're trying with all in us to test more and identify more problems and spreaders and try to stop it. And you got a lot of people out on the front lines that are doing lots and lots of good work, and we just need to stay at it. So thank you, West Virginia.
All right, thank you, Governor. First today, let's go to Chancellor Sarah Tucker with the West Virginia Higher Education Policy Commission.
Good afternoon, everybody. As you know, when our colleges went back to school face-to-face, the governor directed us to test all of our faculty, students, and staff, and we were incredibly grateful that he did. He provided us the resources to do that. We worked with our local health departments, and we're able to help ensure the safety of our campus communities. Now the governor's office is again providing us resources to do surveillance testing on 10% of our faculty, students, and staff each week. This is an ongoing measure on our part to try to make sure that our campus communities are safe. And Governor, I couldn't be more thankful for you for doing that. What's wonderful about the opportunity that we have now is that we knew what a strain the local health departments were under, and trying to make sure that our whole campus community was tested was a huge effort on their part, and they were just wonderful to work with. We didn't want to continue to tax them. So DHHR and the National Guard have been able to coordinate and come up with a solution for higher ed that I think is just terrific. That allows us to do saliva-based PCR tests. The institutions are able to administer the tests themselves. We won't have to rely on or provide further strain on the local health department so that they can continue to do the community testing that the governor has already said is so desperately needed in our state. And so we're very, very thankful for that. We continue at the higher education institutions to have less than 1% week to week of our students, faculty, and staff testing positive. We want to keep it that way. We want to make sure that our colleges aren't contributing to the spread of COVID in our state, and this surveillance testing is a huge way for us to be able to do that. This testing will cover all of our public 2- and 4-year institutions, as well as our not-for-profit private institutions. And Governor, again, thank you very much on behalf of all of higher ed.
Chancellor.
All right, thank you, Chancellor. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Our last site for Wi-Fi support to Department of Education should go up at the Southridge Armory by tomorrow. We continue, as the governor pointed out, with a significant number of testing events across multiple counties. I do want to thank DHHR and all the local health departments for the great partnership and work to make those happen. We're in contact with all those organizations daily. We continue to move resources, manpower around, and meet the intent of what we've laid out and what the governor's laid out to continue to grow our testing numbers and find those spreaders and get them isolated and taken care of with the appropriate health care. Continue to work with DHHR on assisting them as they develop additional lab capacity across the state of West Virginia and our capabilities. Numerous disinfection and sanitization missions continue to occur, to include at prisons and our nursing home facilities, as well as some of our local county offices that have requested support. More teams being added to our testing support capacity, and the governor's given me the authority to add additional National Guard personnel where needed to make those things happen. Thank you.
All right, thank you, General. Dr. Ayn Amjad, our state health officer, is also joining us today and is available for questions. Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Clay Marsh, our coronavirus czar, both had prior commitments today, but they will join us again on Friday. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, a teachers group called the West Virginia United Caucus has launched its own COVID tracking website. People can anonymously report individual COVID cases in schools. Does it concern you that some people may be making their education decisions based on this sort of unofficial information? And does the state have any plans to make an official site like this? I know the other day Dr. Amjad talked about the difficulty of tracking and reporting these individual cases. Thank you.
Charles, I don't know about this site, and I would probably highly encourage parents to think really, really hard about this information that's coming to them from the standpoint of the reporting that I'm giving them, the reporting that our DHHR, all of our health experts, all of our education community, the National Guard, there's lots and lots of people here that are working this around the clock, and they're trying in every way, from our local health departments right on down, right on up, So you got a lot of people here that are really putting in the licks to make sure that they get the information out, and they get the information out as accurately as they possibly can. From time to time, I guess there's a possibility they'll make a mistake, but as I've said over and over and over, I am absolutely capable of making a mistake, but I am not capable of not telling you the truth. So I'm going to make sure that with all in me that the information that's reported to people and is exactly that, is exactly truthful and transparent, and I hope to goodness that we won't get parents acting upon rumors and just, thoughts that, of something, or speculating on different things. But that's why I've led off by saying over and over and over, we wanted to give the parents a choice. And we made it that way from day one, to where the parents did have a choice on what they were going to do with their children and everything. And so I want to be respectful to everyone, but at the same time, I really believe that the results we're putting out are transparent and they're on the money.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, and maybe Dr. Amjad, we're about a month into the sports season in the schools. Have we had any cases that have been isolated on teams, or do we have any information to where perhaps the virus has spread from team to team in the West Virginia sports season so far?
Dr. Amjad, somebody's going to have to answer it other than me because I don't know of any, but if there is any.
Sure, Paul. I can answer that. We had one instance where there was a possibility of it, but our local health department did a really good job of contact tracing. In fact, they even went as far as to watching video of the game that actually was played between these two sports teams to see what children were involved in order to contact trace those two sports teams in order to get a better idea of it. And they did see that there was no transmission, I guess is the best word, between those two sports teams. So as far as we know, as of now, there was not between those two teams right now, but it did go as far as to review those video games of that. So as far as we know, as to date, there was not any that we are aware of.
All right, thank you, Paul. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. The daily map is now mostly green or yellow. Should that have additional effects in West Virginia? For example, I'm thinking, should the Division of Motor Vehicles have more offices open for walk-ins? And in Morgantown, which is green, should the bars be open again? Thanks.
Well, Brad, I'm hopeful that we'll be able to let the bars reopen soon. I think we need to get our feet under us a little bit better than we did the last go round from the standpoint of we got to have some level assurances from the bars and everything that when they go back, that they'll go back with the guidelines and all that in a more stringent way than what we did before. But we'd like to have these businesses back from the standpoint of the DMV. That's kind of I leave that with the Department of Transportation and all that. But and I don't really know how to report on that other than just say this. I think your question more is saying with our mapping being more green, does that mean that things are better and we should be moving in a more positive way? And I'm very hopeful that that's the case. And the only thing I would do is, Brad, is just say this. I've tried with all in me to err on the side of safety. Over and over have I just done exactly that. And from the standpoint, even though we have green counties, a lot of green counties, which is great, and we can have more normalcy to our lives and everything, we got to still be really careful. And I can't say it enough, for crying out loud, I just want us to wear our mask and protect the elderly and absolutely follow all the guidelines and everything. We don't have forever to do this. We're going to have a vaccine. Now, I can't promise you that that's going to come in December or February, but it's coming. We don't have to do this forever. And this isn't the awfulest inconvenience in the world. We know, especially around the globe, how things could be so much tougher on all of us in every way. Now just come on, West Virginia. We're on the glide path, and we're heading and getting ready to go down the runway. So and maybe we hope and pray all of us are going to have a safe landing with this. But we gotta still be careful. We gotta still fly the plane.
All right, thank you, Brad. Next to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. Governor, the president announced earlier this week rapid tests that we're going to go out to states and allow the governors to determine how they'll be used. Have you talked with the administration about how many tests we're getting, and what have you determined those tests will be used for? Will they be used in schools? Thanks.
Yeah, I've not talked directly, but I think I know the answer, but General Hoyer will probably be able to answer this even better than I. So General Hoyer, step in there and answer this.
Yes, sir, Governor. So Amanda, we are still working with federal government on the total number of tests and the timelines on deliveries. We had a discussion yesterday evening, Dr. Amjad, Secretary Crouch, Dr. Marsh, myself, some other folks from DHHR, and still finalizing based on the guidelines that come out from the federal government on where those will go and what they will be used for and how they'll fit into the broader testing plan. But any type of test that we get will help us continue, as the governor says, to go out and identify where we have those spreaders, and working hard to address getting those folks off and taken care of in the appropriate health care. So will be more information to follow as that develops.
All right, thank you, Amanda. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. The West Virginia Education Association is threatening an injunction over the map. And of course, there's a number of cases, both federal and state. I know Metro News talked about the case with the young football quarterback from George Washington. I know that they have filed a case on their own in Kanawha County Circuit Court. Can you talk a little bit about that in regards to their concerns, particularly WVEA, who has the same concerns that have been addressed to some extent by questions we've asked in these briefings in regards to how effective the map is. And related to that, I know Barber County had to shut down and go to distance learning and due to the cases in their schools. But of course, if you look at the map, Barber County is green. So what does that tell the rest of the state when their school system has decided to shut down, at least temporarily? They may be back, I think it was for 3 days, but nonetheless, they're showing up as green. It kind of tells two different stories. Can you talk about that?
Stephen, it's surely a great question. It's a fair question and everything. From my standpoint, if I would tell you this. Again, I don't know how to tell you anything other than what I feel in my heart and everything. But first and foremost, I appreciate and respect people's legitimate concern. I do not have any patience whatsoever with their political motives, and if that's what this is, then I have no patience with that whatsoever. From the standpoint of respect for people's concerns, we all ought to be very, very respectful. From the standpoint of me commenting on a potential lawsuit or whatever, the only thing I could comment is just this, and let's just make it just as simple could be. From a standpoint of, from a political end, my campaign will do what they want and issued statements and everything. Like I said, I've never even been to our campaign headquarters. But from the standpoint of respect for all of us, especially, our teaching community or from the standpoint of our service personnel or our kids, let's just be fair and just say this, and let me just summarize real quickly and just say that, when we started down this path, we had this situation. We had, if you had gone yellow or green and you went orange, you could continue to go to school. And what did I do? I said, that's not right. That's not right. Let's do not do that. And so we basically said, we're not going to school in the orange, did we not? And from the standpoint of, whether it be one of the union bosses or whatever, they went on Metro News and said, oh boy, we think the governor's great and everything. He's doing all this and everything. That's great. Well, the other thing that I have done that they may take issue with is just this, and I'm not going to get down in the weeds and all this, but here's the bottom line to the whole thing. If we don't test, we're going to get worse. That's all there is to it. It's just that simple. If we had just said, well, we're just going to have our state abide completely by the Harvard model or whatever it may be, and we didn't test, and our people, they figured it out real quick that the more they test, the worse it gets. And so if we had done that right now, we'd have a third to a half of our state shut down. Well, I mean, just think how preposterous this is in so many ways. West Virginia is the envy of the nation. I read you the deaths just a minute ago. The envy of the nation, and yet a third to a half of our state wouldn't be going to school. You know, all 50 states are going to school. The only place that's not going to school is Puerto Rico and Washington, D.C. You know, now you surely don't want to be the envy of the nation and be Washington, D.C. or Puerto Rico. I don't get that at all. You know, but in addition to that, so what do? We adjust and we pivot, and we use the standard that the AFT, the biggest teachers union adopted, 5% positivity rate, right? 5%, okay? Now, so that's what we do. And in that, we find another way to go at this, to where people will test. It's as simple as just this. If we don't test, what is the probability of finding the spreaders? Just what the general was just telling you. If we don't test, we can't find them. We can't stop this. So from that, if we use the AFT's positivity thing and we test, the likelihood of us being able to go back to school rises. The likelihood of us testing more rises. The likelihood of us finding spreaders rises. The likelihood of our great health experts then being able to stop this killer rises. So, at the end of the day, if there's lawsuits, there's lawsuits. You know, the courts or whomever, our attorneys, they'll handle all that, but I'm just going to continue to try. I said this to my wife, and I can't say it any better. I'm going to continue to try to do the right thing for all West Virginians. You know, to be perfectly honest and just to tell it like it is, in a lot of these situations, there's politics, and it stinks. It just flat stinks. But I'm going to continue to do the right thing for all West Virginians, and it is not going to have one hint of politics in anything that I do. I'm going to do the right things for West Virginia.
All right, thank you, Steve. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I'm going to follow up on my question from Monday because I got bombarded with phone calls and texts from people. I can't substantiate this or document it, but I'm wondering if you can. Again, there are reports that various student athletes at certain schools in the greater Charleston area and even their parents are getting multiple tests just to bump up the number of negative tests so that the schools can go back to yellow and green and play sports. Now, again, I'd like to, as I did Monday, have the governor address this and Dr. Amjad as well.
Okay, Mark, I have not, I mean, I can't be more blunt than just say this. I'm a coach. I'm a coach and coaches. Honest to Pete, if you are doing this, then you should not be a coach. You shouldn't be a coach because you're setting a horrible example for your kids. I can't be any more blunt than that. I do not know of a single situation in which that is happening, and Dr. Amjad is going to follow me and tell you, but absolutely, that's awful. I mean, it's plain awful. You are the example. You remember what I said the other day? As you're climbing up the hill and you're taking the airs and all that, and you feel lonely and you're tired and all that, you as the coach then look back and you can't imagine how many people are following you because you are the example. Well, for crying out loud, you know, if you're the example and you're doing stuff like this, then that's no good. That's just plain no good. Dr. Amjad, go.
Hi, Mark. Yes, we've been getting those questions and concerns, and I agree with the governor that it's not a good example for young people in West Virginia. And basically, you know, we do want people to test. We do need to know what the baseline of people are in West Virginia are asymptomatic spreaders, as we call them. And people do ask us, how often do I need to test then? When do I test? What is the question to that? And we do need you to test as a baseline if you're symptomatic, if you've traveled out of town, if you're a high risk. But going multiple times to get a number down, we've never asked anyone to do that. If you're doing that to play sports, that's not appropriate. We're getting multiple questions about that. We're getting multiple questions about how we're calculating that. But, that is not what we're here for. If that's a way to game the system, that's not a good representation as a coach, as a parent. But that's not what we're doing. We have people out there working in the rain day and night. Our health department, our National Guard, who's been working since the pandemic started. They don't see their families. We're out there to test people, to get a baseline for our state so that we can serve our people better and to catch asymptomatic people, to catch this virus and to do better. So if people are doing that, that is not what we're here for. And that's all I can say for that as well. But it's not a good example for our young people. And that's not what we do as West Virginians.
Just one second. And just to follow up on that, Mark, is just this, just like we had, in the unemployment claims and the dollars that we were sending out to unemployment, there's going to be somebody that cheats, somebody that does something they shouldn't do. In this situation, we can't be preoccupied with that. We don't want it to happen. And absolutely, we're trying to watch it as very best we possibly can. But we're not going to shut down the system because 2 or 3 or 5 or whatever it may be are trying to cheat out there. I hope to goodness that they won't and they'll listen to me and everything else. But we need to understand that we have got to do what's right for the masses, and we're going to take care of this and we're going to try to send that signal. And for crying out loud, I hope to goodness, I don't know what powers that I have. In fact, I don't have any powers in regard to this, but I just can't imagine it. I can't imagine that at all. It is absolutely the wrong thing for any coach anywhere to absolutely do such a thing as that, because it sets a terrible example to your kids. And that's what this whole thing is all about. It's not about winning a football game or a soccer game. It is absolutely about guiding our kids to a better life as they move forward and you impact them. That's all there is to it. Now, with that being said, I do hope that so much that we will continue to aggressively test, especially in the counties that are orange or, God forbid, red, but even in other counties as well. And the reason for that is one thing and one thing alone. Naturally, it gives us better information to be able to get us back in school. Great. That's absolutely great. But in addition, it absolutely identifies the spreader. I told you about the Bible Center, and I said, and I don't know any more about that, whether that person was positive or not positive. But if we tested 220 some, we found one. We found one positive. What could that one have spread if that be the case? Do you realize the magnitude of finding the one? And we'd never find it if we don't test. Now, Amanda, you asked a question just a little while ago in regard to testing that has come. I think the general answered it. I didn't pay absolute attention to everything the general was saying, but I think we're supposed to get 35,000 tests that's coming from the federal government that's coming next week, and as many as 530,000 additional testing capabilities that's coming in the next 3 weeks. Or 3 months, I'm sorry, 3 months, the next 3 months. So it's really substantial. They're amping up just like all of us are trying to do, because they know the value to be able to stop this thing. You got to do the test, lots and lots of tests.
All right, thank you, Mark. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, I notice we have substitute sign language interpreters today, and the word at the State House is that the regular interpreters have both tested positive for the virus. Can you confirm that, and also tell us what precautions are being taken with staff who have been in contact with these interpreters.
Now, up till right now, I've been pretty good with you today, and not necessarily with you, Phil, but up to now with everybody's got to understand that it's a tough job. You get a lot of questions. You want to be respectful and answer the questions and everything else. But, again, to God above, who in the world are you, Phil Kabler? I mean, who are you? I mean, when it really boils right down to it, who are you to disclose on the air all across West Virginia people's privacy? People's privacy. The same guy that made terrible fun of our service personnel here, the same guy that trashed, our foster kids, the same guy that keeps coming out and spewing out just vile, just more and more vile. Honest to God, I have never seen somebody that absolutely remains in a prominent position that absolutely is out disclosing people's privacy. It's none of your business, Phil. It is none of your business. From the standpoint of what we do here, we are super safe. As we have somebody anywhere in this building that tests positive, everybody then runs and is tested and everything else. It's the very thing you asked the question, when are we going to get to come back in there and do all the news briefings the way we did? Well, I mean, I cannot imagine. Phil Kabler, you absolutely must have absolutely created in Ghostbusters a river of slime, because that's what you do over and over and over. It is the most amazing thing in the world to me. But what right do you have to disclose someone's identity and invade someone's privacy? You have no right to do that. No right at all to do that on the airways that we're talking about here. I just don't get it.
Next to Kenny Bass with WCHS and Fox 11.
Good afternoon. This is Kenny Bass with Channel 8 and Fox 11. Governor, I have two questions. One is easy to answer, and I hope you can answer it. One might be a little bit harder, but real quick about the census. If the census is designed to count how many West Virginians live in the state, how do we know the percentage of people who've responded to it? People have asked me that question, and I really don't know the answer, so I thought I'd throw that out there. Secondly, maybe a little bit more seriously, we've gotten reports and evidence that Charleston Area Medical Center has actually handed out masks to its frontline medical workers, which clearly say marked on the packaging, not for medical use. I know we've talked about CAMC a lot, or at least I have asked about it in the past several briefings. I'm wondering if you've reached out to Charleston Area Medical Center and its CEO, Dave Ramsey, if you've talked about any of these concerns with him. If you have not, are you planning on doing that, considering it is the major healthcare provider in the capital city and the Kanawha Valley, and that some people are kind of asking what in the world is going on over there with some of the things that we found out recently? And if you have any influence or opinions about your role in the situation. Thank you.
Okay, Kenny, let me try to knock them out as quick as I can. From the census standpoint, that's all handled by the U.S. government. They have census employees and census people that are working all this. That's all really that I know, and we just, we're just there. That information is reported back to us, and that's the information that I give you. From the standpoint of what's going on at CMAC and Dave Ramsey and everything, Mr. Ramsey, surely I will help any way I possibly can at any time. I know him really well. He knows me really well. He's got my phone numbers and everything. He can call anytime whatsoever. I think maybe, Dr. Amjad or General Hoyer may be able to report on this a little bit better than I, from the standpoint of wanting our people at, like you said, is maybe the biggest area, health facility that we have. And without any question, wanting our people to be safe and have the right protective gear and everything like that. We have to have that. There's no question. But I don't know more to report on that than that. But Dr. Amjad, if you know anything, or General Hoyer.
Yes, Kenny. Yes. So we reached out to CAMC yesterday to check on their PPE supplies from our health command. I actually have a call set up with Dave Ramsey today to discuss that. But we do. Also, Secretary Crouch does talk to Dave probably daily on that issue as well, but we do speak with them about their needs. They also have their own emergency resources regarding PPE supplies, but they also have an outlet to talk to us about any PPE supplies. I don't know if General Hoyer has anything addition, but I'm going to talk to Dave as well today about those issues.
No, Governor, I would just follow up that we, based on the earlier guidance we were given, we have PPE available. We have not had any requests, as Dr. Amjad said, through Health Command for required PPE for CAMC at this time.
All right, thank you, Kenny. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. My question, I think, is probably more for Superintendent Birch. Unfortunately, he's not there today. But maybe, Governor, maybe you could speak to it if you could. To go back to House Bill 206, not to beat a dead horse, but the $25 million that was made available through there, is there an application process or something of that nature that the county schools have to go through in order to gain access to the funds, or have they been, or will they be directly dispersed to the schools for their hiring for the additional support staff? Thank you.
I think we're really, to give you, I think I know the answer, but I think it's probably best to wait and get that information from, Superintendent Birch, because he'll be better to give that information than I. But like I said, I know it, but I'm gonna pass on that for right now.
All right, thank you, Matt. Our last question today comes from Jade Burks at WVVA.
Hey, everybody. Good afternoon. Mine's a little off topic, but Governor Justice, in regards to last night's presidential debate, what was your reaction hearing the president point to West Virginia as an example of mail-in ballot papering? Thank you.
Well, I would have to say that, we're always concerned about fraud. The president has been a very dear friend of mine, a very dear friend of West Virginia. Way more importantly than anything to do with, one incident or whatever like that, that appears in West Virginia. Way more important than that was just to tell it like it is. I was really disappointed in the debate, in every way. Here we have two individuals that are running for the highest office in the entire world, and it turned into an ugly food fight, and I just think that gosh, I hate like crazy for us in United States of America to have that. I just thought it was, maybe I shouldn't feel this way, but I mean it. I mean it from all in me. I don't want anything. I came here to just do one thing, and that's serve. I came here to just do that. And because I think that's what our forefathers, did, and that's what I am very proud to have done. Right off the get-go, I donated my salary, and we started, and I don't need any kudos for that, but we started up communities and schools, and really got that cranking. Now there was one county that was already going in West Virginia, but my wife Kathy took off on that, and yesterday she told me that 49,000 kids now are being impacted by communities in schools. You know, literally, if you feel the way I feel in my heart about West Virginia, about America, and then you watch, you know, grown men interrupting and grown men that, you know, can't even answer questions and everything. I was really, really saddened by the whole thing. And so I hope to goodness that we won't continue having debates like that. And I hope to goodness that, you know, that there'll be a lot of good come out of maybe a dark moment. And that's all I can say. But it was a disappointing night to me.
All right, thank you, Jade. Governor, back to you.
Well, let me just switch channels and just say just this, that, you know, I keep encouraging everybody to test and test and test. And I am really hopeful, really, really hopeful. Wouldn't it be great? I mean, I think Kanawha County may be the only county so far that's not gone to school a day. And those kids, they need to be in school really bad. I mean, the impact on our children that not being able to be seen by their teachers, or the impact on our special ed kids that have so many different needs, and the impact is unbelievable. And I know that there's certain level of risk. I mean, there's risk for me coming here. I mean, for crying out loud, there's risk in everything we do, you know. But I am really hopeful that if we continue to test, we're going to find those spreaders, and we're going to be able to get back in school. You know, my dad used to always say, you've heard me say this before, there's three ways to build a road, and that's drainage, drainage, drainage. If you get the drainage right, you're going to probably have a pretty good road. Well, I'm going to tell you this, there's three ways to stop this killer disease and this killer pandemic, and that's spreader, spreader, spreader. You got to find them. You got to find them. And that additional testing will enable us to do that. And not only will it enable us to do that, it'll enable us to get back in school. It'll enable us to do so many different things from the standpoint of being able to get back on a ball field or whatever it may be. I'm telling you, without any question, we're on the right track in pushing people and motivating people to get more tests. We're not on the wrong track, and we're not on a political track that's trying to keep us stuck in the mud or whatever it may be. We're on the right track here. And so if we'll just continue to do that, and I want to report to you, and Kanawha County, you may not know this because it only comes out, I think, at a 7-day positivity number and everything, but your 7-day number yesterday dropped to like 6.1%. And all these tests that we're doing, we don't have those in the system, I'm sure, quite yet. But we're going to get them there, and we're going to get them there this week. But in addition to all that, you know, yesterday, your positivity number in Kanawha County dropped to 3.55 for 1 day. For 1 day. Not the 7-day average, but for 1 day. But 3.55 in a county that was blazing red and everything. And so keep it up. I mean, go get tested. You know, we're going to find, you know, a few here and there that don't have any idea that they're positive, and we're going to be able to do something about it. So keep doing it, Kanawha County, and keep doing it all across this state. You know, I commend WVU. I commend Sarah. I mean, what an incredible job she's doing with all of our higher ed. And she came today and reported on testing and everything. And in fact, I didn't even know she was coming until I walked in the door. But what an incredible chancellor she is, and incredible work. And I thank you so much from the bottom of my heart. So with all that said, West Virginia, just keep at it. We're going to get through this. And so thank you so much. God bless you.